Good morning, everyone. My name is Dr. Adipero Okulaja, and I'm here. My name is Dr. Adipero Okulaja, more than a DR dot. And I'm here just to drop a few words about the biggest silent killer in the world. Yeah, the biggest silent killer in the world. When I got to know about this killer, it was eye-opening for me because I already had this enemy in my life. I already had this enemy in my body. And I hazard to say that nearly 95% of the people who are living with this silent killer do not know it. They have no idea that they are ticking time bombs. Now, what is this silent killer that I'm talking about? This big silent killer. This silent killer is called metabolic syndrome. Metabolic syndrome. Now, metabolic syndrome is not a disease. It is what it says. It is a syndrome. It is a constellation or a group of conditions that increase a person's risk for developing heart disease, diabetes, strokes, heart attacks, and the like. In other words, a ticking time bomb. Now, what does metabolic syndrome comprise of? I always tell my patients when they walk in and I tell them, "Oh, you look like you've got metabolic syndrome." They say, "How do you know?" And I said, the average person would not look at a person and say, "Oh my God, you've got metabolic syndrome." Or if somebody just had sudden death, they would not say, "Oh my God, he died of metabolic syndrome." No layperson knows what metabolic syndrome looks like. But today I am going to educate you about metabolic syndrome, the biggest silent killer in the whole wide world. Number one, if your BMI is in the obese and overweight range, you are more likely to have metabolic syndrome. But that is not the measures, because there are a lot of people who are overweight but yet do not have metabolic syndrome. The criteria that we use to define whether a person has metabolic syndrome is based on the waist circumference. That's right, the so-called pear or orange-shaped person. So now, if your waist circumference as a woman is greater than 35 inches, and as a man is greater than 40 inches, you have fulfilled criteria 1 for metabolic syndrome. Number 2, blood pressure above 140 over 90 millimeters of mercury. Some people say, "Oh yeah, my blood pressure is just a little high." Watch it. That's the second component of metabolic syndrome. Number 3. For number 3, you will have to have what we call your fasting lipid profile done. That's your fasting cholesterol profile, which tells you the components of your lipid panel. And if you have high triglyceride levels, that is triglyceride level greater than 150 milligrams per deciliter, you have fulfilled the third criteria for metabolic syndrome. Number 4, low HDL, the so-called good cholesterol that you want to have because it helps to carry the bad cholesterol away from your blood vessels and stores it in the liver, where it is used for various other functions in the body. But when your HDL, your so-called good cholesterol, is less than 40 in men, and if it is less than 50 in women, you are at risk for metabolic syndrome, and that fulfills criteria number 4. Criteria number 5. Criterium number 5. The last criterion is elevated fasting blood glucose. Now, what do I mean by elevated fasting blood glucose? It's blood glucose that is greater than 100 milligrams per deciliter. So to recap the components of metabolic syndrome: waist circumference in women of greater than 35 inches and in men greater than 40 inches, number 1. Number 2 is low HDL, which is a good cholesterol, less than 50 in women and less than 40 in men. Number 3, high triglyceride levels of greater than 150. Number 4, elevated blood pressure of greater than 140/90. Number 5 is elevated fasting blood glucose of greater than 100 milligram per deciliter. These are the things that you need to look out for. To do this, you will have to go see your physician, which I advocate. I advocate that everybody over the age of 40 should see their physician at least twice a year. Once for a general checkup, and 2 just to make sure things are going right. And if you go in to see your medical doctor and your BMI is greater than 30, and especially if you have the so-called orange-shaped habitus, which is you have thinner legs, thinner arms, and a roundish belly, and a waist circumference greater than 35 inches in women and greater than 40 inches in men, you need to have your doctor check these criteria to make sure that you do not have metabolic syndrome. Because these factors, which in and of themselves, one by one, do not constitute a huge concern, but that needs to be watched. If you have one of these, even 2 of these, you need to be careful, because once you have 1 or 2, it is easier to go to number 3, number 4, and number 5. So if you go to your doctor and you find out that at least 2 of these components are elevated, you need to be extra vigilant. If only 1 is positive, you need to be vigilant. But 2, extra vigilant. 3, extra vigilant. 4, extra vigilant. And 5, you need to make a concerted effort to reverse the effects of metabolic syndrome, because these conditions as a constellation have the highest risk factor of a person developing type 2 diabetes, coronary artery disease, atherosclerotic vascular disease, risk of stroke, and increased risk of heart attack, and the final nail in the so-called coffin, sudden death. So if a person that you know, active, very, very vibrant, vivacious, but is a little overweight and has a little bit of a belly and has a little bit of high blood pressure, a little bit of high glucose, and an abnormal lipid panel, that patient will not look, or that person, will not look like their numbers. But then you hear, oh, that person died suddenly. No, it wasn't remote control. Well, again, you're wondering what remote control is. It's in Africa when we think that people are being targeted by witchcraft. No, it is not witchcraft. It is not juju. It is not witchcraft. It is called metabolic syndrome. The greatest silent killer in the world. And it does not discriminate. It affects men and women equally. So please go to your doctor. Make sure that you exercise, eat healthy, measure your waist circumference. And if it's over 35 in women and over 40 in men, it's time to get active. It's time to start looking at your diet. Go in, check your blood pressure. If it's over 140, over 90, please address it. Check your fasting lipid profile. If your HDL is less than 40 for men, less than 50 for women, and your triglycerides are high, over 150, and if your fasting blood glucose is greater than 100 milligrams per deciliter, you need to nix metabolic syndrome at the root. Again, the biggest silent killer in the world. Protect yourself, be educated, be healthy, and stay alive. God bless you. Have a wonderful weekend. Bye-bye.